I've got a riddle for you today. What can present the symptoms that what one disease process can either have cough or chest pain or wheezing or hoarseness or lots of saliva being produced in your mouth, and it all comes down to one single disease process. The answer is GERD, or gastroesophageal reflux disease. One of the GERD is such a not very nice sounding abbreviation. People usually call it heartburn or reflux, and it's all the same thing. It can have all these different ways of presenting. Different people feel it in different ways. So let's talk about it today because it can be a great mystery that I have a patient that comes in with a cough and I end up treating them the same way as someone who comes in with wheezing and the same way as another person who comes in with nausea that just won't go away any other way. And sometimes it ends up being reflux. So that's what GERD stands for, is gastroesophageal reflux disease. So what's happening is in your stomach, you've got acid being made to help you digest your food. And if it goes up instead of staying down where it's supposed to, it can irritate your esophagus, this tube that connects your mouth to your stomach. And it can even go all the way up to your mouth and you can taste that like acidy taste. So that's actually one of the symptoms that people can have when they first realize that they are having reflux. So sometimes it feels like a burning in your chest after eating, kind of right behind your sternum, your breastbone right there. And that would be the classic heartburn kind of sensation. I remember the first time I ever felt bad heartburn, I was pregnant with my first child and I had had about 4 Shirley Temples. Whew, and those bubbles really caused a lot of havoc in my stomach and it caused bad heartburn. I thought I was dying. And then I thought about for a while and it feels like my heart is burning right there. I have heartburn. It was a revelation. So maybe you've had a similar experience recently and that's why you're watching this video. Another symptom that you could have is, I'm sure we've all had it, that kind of regurgitation, the bit of food from your last meal coming into your mouth, sometimes with chunks even, and a little bit of that acid taste. Bleh. Or some people will just have a low level of acid in their mouth a lot and not necessarily that big bleh event of grossness. That can be a symptom of GERD. Some people will just have a little bit of low-lying irritation right around the bottom of their esophagus, or even your breathing tube kind of breaks off up here too. And you can imagine the acid coming up and irritating that area near the breathing tube. And so you can get a cough. So a chronic cough that doesn't seem to respond to allergy medications, doesn't seem to be just when you're sick, always just tends to be there. That could be GERD as well. It's just coming up just barely enough to irritate that spot and cause that cough, but it's a sign of otherwise underlying problems that should be treated. So it's a good thing to know you have. Some people will have it come up and irritate right up here, and it'll irritate more of the esophageal side, and they'll have painful swallowing. Or hoarseness, that's kind of that same area that the vocal cords are getting irritated by the acid, or wheezing. It'll cause so much irritation along the breathing tube that it'll have a slight narrowing, which can cause wheezing, but it doesn't get better with albuterol, unlike asthma, which would get better with albuterol, so that can be a sign. Or some patients will have just a constant nausea feeling. Nausea is kind of a symptom that our body gives us when it's not sure what else to tell us. And it could just be from irritation of the esophagus. We're not even sure. But if it gets better with the treatments for GERD, that's a good sign that that's what it could be like. It can even have, like, some people will just get a rush of saliva into their mouth for no apparent reason. It's called water brash is another phrase for it. And that can be a sign of reflux. Or even a squeezing chest pain that's a lot like a heart attack, a lot like angina or angina. It can feel very similar. So it can be very frightening to have a bad episode of of heartburn, because it feels like you're dying of a heart attack, but you're not, it turns out. So what do we do about this? That's one of the tricky parts, is that if you leave it untreated and you have high levels of acid that are irritating places that aren't supposed to be irritated, you can get an ulcer through your stomach, a hole through your stomach, or even cancer of the esophagus or other areas, because it's just being constantly irritated by that strong level of acid. So that's not good. Not to mention that it's not comfortable. It's not nice to have these symptoms. So it's a thing that I like to treat, but you also don't want to treat it too much, because there are also concerns of being on too high of a level of medication and having side effects from those medications. Because that acid is there for a reason. It helps you to absorb things appropriately. So let's say we do decide to treat your heartburn. They found that it changes, lowering the pH in your stomach, taking away that acid, while it makes your symptoms feel better, it also impacts a lot of the digestion. So you're going to have trouble getting enough magnesium, calcium, B12, and iron into your system because it's not being absorbed as well without the acid. That's what the acid is there for, to help break things down and help you to absorb these important minerals and vitamins better. Drat. They've also found an increased rate in certain kinds of infections when you decrease your stomach acid, when you increase that pH. So that kind of makes sense to me, in that I can imagine certain kinds of bacteria getting stuck in your stomach and getting killed off by that acid. But if it's not there to kill, then they can cause other trouble other places. I know they've seen certain kinds of digestive infections and pneumonias tend to increase if you have stomach acid constantly being turned down, constantly treating this for years and years and years. So that's a problem too. Then you can also have problems to your kidneys, especially with the highest levels of medications for your reflux. So proton pump inhibitors is what they're called, can cause damage to your kidneys with long exposure. So as in with all of medicine, it's a risk, and you have to measure the risks with the benefits of what you're getting out of this medication. These symptoms are real. They're really getting in the way of your life. But also real are the side effects of decreasing that acid in your stomach. I mean, having less calcium means that you're at a lifelong higher risk of low bone density or osteoporosis. Having low iron could make you have less energy, more fatigue, more difficulty circulating oxygen around your body. So those are real too. So it's a discussion to have with your doctor for sure. But if you're just sitting there wondering, man, I have this bad heartburn, what can I do about it right now? I like this kind of step up, step down approach to treatment. So the first easiest, well, not necessarily easiest, but the one the most keep in mind no matter what, is ways you can alter your lifestyle and diet so that you're not having this acid bubble up so much. So things like weight loss, if you have less weight pressing on your stomach, causing this acid to go up more, that can be really helpful for your symptoms. Some people notice it the most if they lay down after they eat because the gravity isn't pushing the acid back down where it belongs. So finding ways to avoid laying down, whether for bed or any other reason, for 2 or 3 hours after you eat anything. Or also elevating the bed. You could put blocks underneath the head of your bed, the stand at the head of your bed, maybe 6 to 8 inches worth of blocks. Make sure it's stable. Or just a foam wedge just under your pillow or under your mattress can be helpful too. And avoiding the foods that tend to cause your acid to get better. You can use any number of apps out there to try to figure out which foods tend to give you the worst acid. The common culprits tend to be ones that you're going to miss. So caffeine, chocolate, spicy foods, high fat items, carbonation, that's me and the Shirley Temples, the carbonation really got me. Mint can sometimes make it worse. Alcohol and tobacco all tend to be the ones that cause your heartburn to get the worst. So being able to cut some of those out, maybe you don't need to cut them all. Maybe you don't have to get rid of chocolate forever. Maybe if you just quit smoking, lots of good reasons to do that. Maybe that would take care of your heartburn. So that would be worth it. That would be great. Another thing that some people will do will suck on lozenges or mints, especially sugar-free ones, to preserve those teeth throughout the day, and just that constant swallowing can keep this acid being pushed down constantly and they get less acid. Okay, so that's the basic ones to keep in mind, but it's still driving you crazy. First thing to try, if this is just once in a while, you don't get this very often, try one of those over-the-counter antacids, the ones that tend to be chalky, and some people really like the taste, some people hate it. It does tend to cause constipation, but it's also a calcium supplement, so that's kind of nice. You're getting some extra calcium in there. So those would be like Maalox, Tums, that kind of thing. So try a couple of those. If that doesn't make things better, or if it doesn't last long enough, then it's reasonable to go on to the next step. So these are called the H2 blockers. The things like ranitidine, famotidine, things that end in tidine. Those have been getting a lot of bad press lately, ranitidine, because it's chemicals used in its manufacture have been linked to cancer, so they've taken that off the market. So you can't currently find ranitidine, also called Zantac, right now. Maybe by the time you're watching it, they found a better way to make it and it's back on the market. It's a great medication. But they have a number of other ones out there too. They all end in tadine. They're all antacids. They work pretty fast, not as fast as the antacids do. But if you take it in about half an hour to an hour, it should start having some good effects, and it can last up to about 12 hours. So it's a good medication to take if you have it every once in a while, a little bit more often than the antacids, but not quite. You can control it with that. Good, stick with that. Don't go onto the PPIs unless you really have to. And there are definitely cases when you really have to. So proton pump inhibitors actually completely shut off the acid being made in your stomach. So that's a pretty strong medication there. That's really going to cause a lot of these side effects, but sometimes it's worth it. And I don't want to take that away from you. So the important thing to remember about these is you can't take these just any time and have them work as well. If you're going to turn off that acid to your stomach, you want to make sure there's no acid already in there. So you want to take it about half an hour before your first meal of the day. That way it's shut down before you're even thinking about food, and it'll work best that way. So take advantage of those full effects if you're going to take those. These kinds of medications are the ones that end in prozol. So omeprazole, esomeprazole, Nexium, Prilosec, those kinds of medications. Take the brand name, take the generic, whatever's less expensive. And there's a lot of flexibility in the dosage, especially if you talk to your doctor about it. But again, it is the strongest level of antacid medications that we have. It's pretty serious stuff. So if you're starting to realize that you've been on this medication for years and years, you've been feeling great, you could try dialing it back to decreasing your dose of the PPIs or even stepping down to an H2 blocker instead. So now you know a whole lot about GERD, or gastroesophageal reflux disease. Super common, presents as all sorts of different ways. Give some of these treatments a chance while you're waiting for your doctor appointment, unless you're with a direct primary care practice like my own and you can get in and see your doctor really fast. Then just come in and talk to your doctor about your options. If you found this helpful, please watch these other videos, also about the digestive system, or subscribe to our channel, or both. Thanks for watching.